Welcome to PTCB 2026 Med Storage Mastery. This video will cover pharmacy technician exam prep, focusing on proper storage, exam tips, and study strategies for medication storage. Let's review top exam distractors for storage and handling. Focus on the correct concepts, such as controlled room temperature being 20 to 25 degrees Celsius and refrigerated storage being 2 to 8 degrees Celsius. Avoid vague distractors often seen on the exam. Understanding critical temperature ranges is essential. Memorize the exact numbers. Controlled room is 20 to 25 degrees Celsius. Refrigerator is 2 to 8 degrees Celsius, and freezer is minus 25 to minus 10 degrees Celsius. For insulin storage, unopened vials must be refrigerated. Once opened or at room temperature, the 28-day discard rule applies, regardless of the printed expiry. Never re-refrigerate opened insulin or use frozen insulin. The ideal controlled room temperature, based on USP standards, is 20 to 25 degrees Celsius. A tolerated excursion range of 15 to 30 degrees Celsius is allowed, but only if brief and documented. Always choose 20 to 25 degrees Celsius as the target. Light-sensitive medications, such as doxycycline and nitroprusside, must be stored in the original amber container and placed in a light-proof bin. Record exposure time to prevent degradation. For specific medication rules, always keep desiccant packs inside the original bottle. If aspirin smells like vinegar, it is hydrolyzed and must be discarded. Sealed blister cards must remain sealed until dispensed. Controlled substance storage requires strict protocols, including a double lock mechanism and perpetual inventory. Refrigerated controlled substances must be kept in a locked amber box. Crucially, a witness signature is mandatory for transfers. For Class 1 recalls, follow the immediate action protocol. Step 1. Secure the product in a red quarantine bin. Step 2. Remove from all stations within 24 hours. Step 3. Notify patients within 3 days. Never return recalled products to stock. Regarding excursions, understand the less than 24-hour rule. If an unopened Humalog pen is at room temperature for less than 24 hours, return it to the fridge. Do not start the 28-day clock or discard it yet. In this sample question on light sensitivity, doxycycline is the correct answer. It is highly sensitive to light and requires light-protected storage to prevent degradation and toxicity. If a CII discrepancy is found, the first action is to immediately notify the pharmacist and initiate an investigation. Do not adjust the log until the investigation is complete to maintain chain of custody. When a patient wants to transfer tablets with desiccant to a weekly organizer, advise them to keep the tablets in the original bottle. If a transfer is unavoidable, move the desiccant into the organizer to absorb moisture. For a Class 3 recall, the action is to remove the remaining stock from the shelf. Patient notification is not needed for a Class 3 recall, as they are unlikely to cause serious harm. Train your brain to automap key storage scenarios. For ideal storage, pick 20 to 25 degrees Celsius. If the stem says excursion allowed, pick 15 to 30 degrees Celsius. For Class 1 recalls, think, quote, notify patient. Use a timed exam strategy for storage questions. First, spot keywords like refrigerated or controlled. Second, eliminate distractors quickly. Third, confirm your answer with drug knowledge and select the best fit. Be aware of common temperature traps. Distractors often use close number pairs or swap terms like, quote, refrigerate versus freeze for biologics. Focus on the exact values provided in the question stem. Practical scenarios must be mastered. Discard nitrostatin if it shows discoloration. Immediately discard frozen Lantus. Amber vials are not always enough. Some medications require a dark drawer. Quarantine recalled lots in a red bin. Review medication degradation examples. Aspirin with a vinegar smell indicates hydrolysis and should be discarded. Doxycycline turning yellow is a sign of photodegradation. These statements are all true and critical for the exam. Key memorization pearls include exact USP ranges for room and fridge temperatures, the insulin 28-day rule, and the importance of the desiccant. Remember the dual lock requirement for CIIs and the immediate patient call for Class 1 recalls. This concludes our video on PTCB Med Storage Mastery. We covered essential proper storage, exam tips, and study strategies to help you succeed on your certification exam.